Hi, this is Andrea Kane, and I'm here with HSC 114 Medical Terminology. We're studying the Language of Medicine, 12th edition by Davy Ellen Chabner. And we are now on week 8, looking at chapter 12, Respiratory System. If you're looking at your syllabus, this is course objectives 8.1 through 8.7, and which we are still on for the whole thing. And our unit objectives are 9.8.1 through 9.8.8. So if you are looking at specific objectives in your syllabus, look at 9.8.1 through 9.8.8. As always, we're looking at the organs of the system that we are studying, which happens to be the respiratory system, looking at their location, function, and then what can go wrong with those, the pathologic conditions, medical terms, tests, treatments, abbreviations, and making sure we understand them in their proper context. So let's get into it. By talking about external respiration, that is the exchange of air in lung capillaries. So oxygen is inhaled into the air sacs of the lungs. When you inhale, that's what you're doing. You're pulling that oxygen into the air sacs of your lungs. It immediately passes. The oxygen goes into those capillaries, and then carbon dioxide passes from the capillaries into the air sacs and is exhaled. So when you're inhaling, you're taking in all that oxygen. It's going down through the air sacs of the lungs into the capillaries to do the exchange with the blood, where you're giving blood or oxygen to the blood, and you're pulling the carbon dioxide out of the blood through the capillaries into those air sacs of your lungs, and then you're exhaling that carbon dioxide out. So that's what external respiration is. You're exchanging air in your lung capillaries, bringing in oxygen, getting rid of carbon dioxide. Internal respiration is when the exchange of gases takes place in the cells. So that is happening simultaneously between the cells and the capillaries. That is the piece where the blood, where the oxygen is passing out of the bloodstream into the tissues. The carbon dioxide comes out of the tissues back into the bloodstream. So external is in and out of your lungs, and that's in the capillaries going into the blood. Internal respiration is when that oxygenated blood goes out to the tissues, and it unloads the oxygen in the tissues, and it picks up the carbon dioxide from the tissues and takes it through the bloodstream back to the lungs to be exhaled out. Respiratory anatomy. You have a mediastinum. It is the middle of your chest where your trachea divides into two branches. That's your mediastinum. Bronchi. Each leads to a separate lung. Lungs. There are lobes, but they are not mirror images, interestingly enough. You have a hilum, and that is made up of blood vessels, nerves, lymphatic tissue, and bronchial tubes that enter and exit. And here is a good visual of the anatomy of respiration. If you see, you can see where the air comes in. I'll move my mouse here. Hopefully you can see it on the screen. You're breathing in either through your nose or your mouth, and it's coming down through your trachea, not your esophagus. Remember, it's not your esophagus. It's coming down through your trachea into your lungs. And then, it goes into the air sacs of the lungs. So let's go down here, and you can see where you've got the close-ups of what is happening, the exchange, where the O2 is going out into the bloodstream and the CO2 is coming in to be exhaled out. So it gives you that external respiration view. All right, so some structures you're going to run across when it involves conducting air. It's your nose, nasal cavities, and paranasal sinuses. All right, let me say that again, sorry. Didn't mean to stumble over that. Nasal cavities and paranasal sinuses. Pharynx, larynx, and trachea. Your pharynx and your larynx are not the same thing, so make sure you know the difference. Exchange of gases involves bronchioles, alveoli, and lung capillaries. This is a good visual to let you know where you're taking in that air, usually through your nose, passes through your nasal cavities and paranasal sinuses. I don't know why I keep stumbling over that. Not like it's a Monday or anything. Pharynx, past your adenoids and tonsils, down into your larynx. And remember, you've got the epiglottis in there, and then into your trachea. And bronchi, bronchioles, alveoli to the lung capillaries, which goes into the bloodstream. All right, so vocabulary, we have adenoids, alveolus and alveoli. Notice the difference between the singular and the plural there. Apex of the lung, base of the lung, bronchioles, bronchus and bronchi. So again, notice the difference. Carbon dioxide, cilia, diaphragm. Your diaphragm, it's that muscle that separates the chest and abdomen, and it contracts to pull air into the lungs and relaxes to push it out. So make sure you know this. This will be very important. Hint, hint, hint. All right, epiglottis, expiration, and glottis. Difference between epiglottis and glottis, okay? Hilum, inspiration, larynx. Lobe, mediastinum, nares. Oxygen, palatine tonsil. Did you know you have 2 palatine tonsils? All right, paranasal sinus, parietal pleura. Parietal pleura. We learned about parietal when we talked about the brain in the nervous system, because there's a parietal part of the brain, but it's here with the pleura. It's an outer. It means an outer fold. So don't let that trip you up. Pharynx, pleura, pleural cavity, pulmonary parenchyma. Respiration, trachea, visceral pleura. Remember, we just had parenchymal pleura. Now we've got visceral pleura. Make sure you know which one is inner and which one's outer. Hint, hint, hint. Okay, so what is the tip or uppermost portion of the lung? You definitely know it's not nares. That has to do with the nose. The base is usually the bottom. And so that leaves lobe and apex. Which do you think it is? All right, combining forms. Remember our lovely equation. You have a root plus a combining vowel equals a combining form. Here we have adenoidal, alveolo, broncho, and bronchio. So watch out, broncho and bronchio. Different there. And bronchiolo. So watch out for these because they do mean different things, and they're spelled just a little bit differently. Capno, conio, cyano, epiglotto, laryngo. Remember how when you spell it with an NX, that X turns into a G when you're talking combining form. Larynx, laryngo. Lobo, mediastino. Naso, ortho, oxo, pectoro. Whoops, I went backwards, sorry. Pharyngo, another one where that X changes into a G. Phono, freno, pleuro, pneumono, pneumono, and pulmono. Watch out, you've got 3 here that can mean lung, but pneumo is usually air, but it can be lung as well, so watch out for that. Rhino, sinuso, spiro, tello, thoraco, tonsillo, tracheo. And now we have suffixes. Ema, osmia, nia. And remember with that PN, you only pronounce the N. Nia. Ptysis, that's spitting. Again, the P is not really pronounced. It can be dyspnea or, I don't know, hemoptysis, that's spitting up of blood. Dyspnea is difficulty breathing, so watch out for those. Asphyxia, thorax, and now we're on to diagnostic terms. Auscultation, percussion, pleural rub, rales, crackles, rhonchi, notice the singular is rhonchus, sputum, stridor, wheezes. And for the definitions of those, I'm going to refer you back to your book. What can go wrong with the respiratory system? Well, you can have some upper respiratory disorders such as croup, diphtheria, epistaxis, and pertussis. Typically, diphtheria and pertussis are vaccinated against when you're a child. Epistaxis is a bloody nose, in case you were wondering. Bronchial tube disorders. Asthma is a huge one. Bronchiectasis, chronic bronchitis, and that kind of starts edging over into the COPD umbrella of chronic lung diseases. Cystic fibrosis is a congenital genetic disorder. So some other lung disorders, atelectasis means you have a collapsed lung, atelectasis. Emphysema, again, is kind of under that COPD umbrella of chronic lung diseases. Of course, you can get cancer. Pneumoconiosis, pneumonia, pulmonary abscess, pulmonary edema, pulmonary embolism, or pulmonary emboli if it is plural, PEs. Pulmonary fibrosis, sarcoidosis, and tuberculosis. Just some things that happen. So let's talk about atelectasis and that collapsed lung. There are two forms. One has to do with obstruction of the distal airways. So somehow there's some kind of obstruction in there, and that's this A visual that you have here. You've got that obstruction, and that causes the lung to collapse. Or you could have fluid or air accumulation in the pleural cavity that could cause the lung to collapse. Unfortunately, one side effect of doing, sometimes they'll do a needle-guided lung biopsy, and it will cause atelectasis. It'll cause the lung to collapse, and it's just, it's not preventable, but sometimes it happens. All right, pleural disorders. There's mesothelioma. You may have heard about that. There's a lot of attorney ads on TV about mesothelioma victims, and that's usually from coal dust or some kind of inhaled type of substance that causes lung damage, and or lung tumors or that sort of thing. Pleural effusion can happen when fluid backs up into the lungs. Pleurisy, also known as pleuritis, and pneumothorax. All right, pneumothorax. That's another one where you have a collapsed lung and you have air that gathers into the pleural cavity where it should not be. And this is just a visual of that. All right. Some other things they give you here are anthracosis, that has to do with coal again, I believe. Asbestosis, obviously that's due to asbestos exposure. Bacilli, COPD, chronic obstructive pulmonary disease. It's sort of an umbrella that includes a lot of these types of chronic lung diseases. Cor pulmonale, exudate, hydrothorax, infiltrate, palliative, paroxysmal, pulmonary infarction. Yes, you can have a pulmonary infarction, not just a myocardial infarction. You can have some issues with purulence or silicosis. So these are all things that you can study. You can go out and Google if you have questions and that sort of thing. And in fact, I do believe that our discussion this week is on emerging trends in COPD. So that'll give you a little bit of exposure there, but make sure you study these terms. All right, clinical procedures. Obviously, x-rays. Chest x-ray is the most common, but there's CT of the chest. There is pulmonary angiography where they're looking at the blood supply and how that's flowing through the lungs. There is, this is an example of a chest x-ray, and it's normal. This is an MRI image. PET scans are definitely something that'll pick up if there's any cancer metastasis to the lungs. They often do VQ scans, ventilation perfusion. You inhale radioactive gas for imaging, and then they inject a different radioactive material and take the images. So you do have nuclear medicine that's involved with lung testing or respiratory system testing. Bronchoscopy, this is where they'll put a endoscope down and they go in and take a look around into the lungs. They can do it for diagnosis, do it for biopsy, where they do actually do a lung biopsy, collect secretions. They have a brush at the end of the catheter, and that can help remove cells or tissue, what have you, for that biopsy. Endotracheal intubation. You may have heard of somebody who's been intubated, and typically after they're intubated, they are put on a respirator or a ventilator. And what they do is they are doing this to open the airway. For whatever reason, the person's airway is not open, they're not able to breathe. So they use a laryngoscope and an endotracheal tube and get that going. And so this is just a visual of how they put that down through. So laryngoscopies are done, lung biopsies, mediastinoscopies, pulmonary function tests are very common to see how someone is breathing, if they have issues with that. Thoracentesis, I'm sorry, let me go back to PFTs or pulmonary function tests. They can also see if somebody's not able to inhale completely or exhale completely, or if their lung capacity is somehow minimized. And then thoracentesis is going in and pulling out some of the fluid around the lung. Thoracotomy is making an incision in there. Thoracoscopy, you've got that scoping going on again. Tracheostomy, that's where they have to cut a hole in the trachea so that someone can breathe. Maybe there's some kind of obstruction there, blockage, what have you, but in order for them to breathe, they'll cut a hole in the into the trachea. Tuberculin test, tube thoracostomy. Thoracentesis, this is when they're removing fluid from the pleural space, and this just shows you where they're going to go in from the back side to get to that fluid. Tracheostomy, talked about that, where they need to put in an opening for breathing, and they can actually insert what's called a tracheostomy tube after they do that. They've got to keep that airway open so someone can breathe. Abbreviations, there are plenty here when it comes to the respiratory system. So let's keep going through here. Just make sure that you're familiar with these. And some more. All right, more combining forms or some of the same. It actually looks like they're mostly the same. Adenoido, alveolo, broncho, bronchio, bronchiolo, capno, conio, cyano, epiglotto, laryngo, lobo, mediastino, naso, ortho, oxo, pectoro, pharyngo, phono, freno. And notice here, freno can also mean mind, so you have to really be aware of context. Pleuro, pneumo or pneumono. I guess I was trying to pronounce those two together. Sorry about that. And pulmono. Rhino, sinuso, spiro, tello, thoraco, tonsillo, tracheo. And then those suffixes, ema, osmia, nia, ptysis, asphyxia, thorax. And that is it. We have flown through the respiratory system. That took way less time than what I thought. I hope you're doing well. I hope you have a great week ahead. I will be back next week, which will be week 9, to talk to you about chapters 13 and 14, the blood system and the lymphatic and immune systems. So we will look forward to that. Have a great week. Take care. Hope you have good weather.